please briefly recap your career and how it led you to become the next president and CEO of the college?
So I'll go all the way back, but there is a thread that runs through this. So I'm first generation American. And so, of course, was raised with that, school is really important and professions are important and you do have to give back to the world. And so I actually decided that I wanted to be a physician really early in life. If you ask me why, it's probably because of my pediatrician. We live 2 blocks from the hospital. He always stopped in on the way to the hospital. And thinking back, to that age, he actually always encouraged me in terms of academics and school and things like that. So I always knew I wanted to be a pediatrician. I think the next pivotal point was that I was accepted into the Northwestern 6-year medical program in my junior year of high school when I was 16. And what that program does is it actually guarantees acceptance to medical school. At the time, it was a 6-year program. I think now they've changed to 7 years, but you do 2 years of undergraduate and then you go right into a 4-year medical school program. And Northwestern did this program really well. A third of the medical school class were 6-year meds. So we were 2 to 3 years younger than everybody else, but there were enough of us that it worked. But I think the important piece of that was that, the different points along someone's life when you could go into a different direction weren't there for me. A lot of people after college decide to do something else, or it's hard to get into medical school, so you end up pivoting to something else. I didn't. I went right into medical school with the intent of being a pediatrician. Almost got sidetracked to surgery. And to be perfectly honest, if it wasn't in the late 1970s and I wasn't a woman, I would have done that. There's a lot of gratifying things. You can fix things if you're a surgeon, and I could have done that in pediatric surgery. So I went in a completely different direction. I fell in love with genetics. The chief of pediatrics at Northwestern was a pediatric geneticist named Henry Nadler. I did research with him from my freshman year on, fell in love with pediatric genetics. It was an early field at that point. Genetics wasn't even a specialty. And what geneticists did was take care of kids with unknown conditions, with structural abnormalities, with developmental delay, with metabolic abnormalities that we didn't have answers for, and I liked puzzles. So I trained in pediatrics, then I came to Boston, trained in genetics at the Harvard programs, and then spent 30 years in academic medicine in Boston. And it was a pretty standard academic career. I did clinical work, I did clinical research, I ran the training programs at Harvard in medical genetics and in laboratory genetics. Near the end of my time in Boston, I sort of pivoted part of my time into hospital management. Spent a year at Harvard Business School in their professional leadership development course. And I was actually thinking in Boston at the end of those 30 years, whether I was going to pursue a department chair or a CEO of a children's hospital. There aren't a lot of clinical departments of genetics, and genetics actually isn't a subspecialty of pediatrics. So from a pediatric department chairperson, that doesn't happen that often. And at the same time, I was also doing a lot of national medical work. I was the RRC chair for ACGME for medical genetics. I sat on the board of of ACCME. And was on their accreditation review committee. I was the CME officer, the education chair, and then the board of the American College of Medical Genetics. So I was getting interested in national medical organizations and sort of how they maybe more effectively move the needle, on a larger basis. And so this job came up. I was contacted about the job at the American Board of Medical Specialties, which is the umbrella organization of the certifying boards, as the senior vice president of academic affairs. It was in Chicago. I'm an only child. My parents had moved out to Boston when my kids were little to help care for my kids, and it was time to move them back. My mom had dementia. My dad was getting older. And so, Chicago made sense for both professional and personal reasons. So came to Chicago, did that, got my parents through their last years. And then I was contacted about the job at the American Medical Association to be the chief health and science officer. That job provides thought leadership and guides the organization at the intersection of science and medicine, which is how geneticists practice, how we've always practiced in a new field. At the AMA, I spent a lot of time with the advocacy group, really understood the importance of policy and advocacy at the federal and state levels, and also how to communicate effectively, how to use new forms of communication for both physicians and the public. Then the pandemic hit. Yeah. And it's interesting. One of my colleagues in senior leadership at AMA was introducing me to his group, and he said Mira met her moment with COVID. And I think that just meant that I actually led the COVID pandemic response for the AMA, which is a very large organization. But basically what that meant was I provided that thought leadership, worked really closely with advocacy, communications, the website people that, controlled the website to develop in real-time information to guide physicians and the public in terms of what they needed to know. Then this opportunity came up. And I think if you look at the threads, the threads that ran through my career, one was always child health. I was always trying to optimize child health in whatever we did. And then it kind of went to more broadly, how do we optimize health, but always grounded in the profession. The profession is incredibly important to me. It has given me so much. I can't imagine doing anything else. When I stopped doing patient care 6 or so years ago, it was really hard. I really felt that I was somehow failing something. And then I kept telling myself that, well, you did it for, you cared for people 35 years. People retire after 35 years. The profession has given me so much. And coming to the college to help educate not just physicians, but also the public in terms of the history of the profession, how it actually informs the future of medicine and healthcare. And the last thing I'll say is that the pandemic has been the most important teaching moment of our time. I don't think that any of us will ever live through another teaching moment like this. It's one of the important things that it's taught us is that medicine can't just do what it wants to do by itself, that it's really important to engage, the medical side of the street, the public health side of the street, because we do have these two siloed healthcare groups, but also the public. And I think we're seeing that with this vaccination issue.
Sure.
I think that it's really important to engage the public. We knew that. We've known that over the last 10 to 15 years, but the vaccination crisis that we have now is just making that abundantly clear that we have a lot of problems in this country and in healthcare, and we can't optimize health by not engaging everybody that's involved in it. And the college does that so beautifully.
Well, fantastic. And I think that's a great segue to the next question. And it is that over the last year and a half, you've taken a very forward-facing role at the AMA, providing both physicians and the general public with frequent video updates on the state of the pandemic. And how will you use that experience now that you're becoming the primary face of the college?
So, interestingly enough, that I learned a lot at AMA, but this whole communications piece was really the most enlightening to me. When you're a physician, you learn things through continuing medical education, right? So you think of things in terms of large convenings, you go to meetings, you read, you learn at home, CME articles and things like that. But what we did at the AMA, and it was a complete group effort, and the communications and physician experience groups at AMA are just phenomenal. The intent was to reach people in any way they wanted to be reached. Social media, Twitter, video interviews, the JAMA conversations with Dr. Bachner. Everybody likes to get their information in a different way. Some people like to read medical journals and do CME activities. Others want a 10-minute video update. And I think the group used social media really effectively, AMA statements, getting information out, but also tweeting, CDC statements and getting that out. But I did learn that, you need really young people to develop tweets. My mind doesn't think And that, but there are people that do that really well, right? And that's important. But also the video interviews, I'd love to do at the college because, this started out as like Todd Unger, who's the chief experience officer at AMA, started doing these video updates, and they were supposed to be 10 to 15-minute updates. They were all COVID related. I did a weekly update. This is what happened in the last week. This is where we are. But other people, I know that Dr. Offit was nice enough to do a few of those for us, and it hit all aspects of the pandemic, but it's incredible how popular those became. Yeah. Because they went out by social media, so everybody and all of their friends on Twitter, saw it, but they were also on the public website, and people actually started to come and look for them. And that's how they got their information. So, with that comes responsibility. Yeah. You have to provide really accurate information and be clear, but it translates into people knowing who you are as an organization and why you're there. And I think the college, in some ways, is like one of the best kept secrets. And I don't say that in a negative way, but you don't want it to be a secret. You really want people to know everything that happens in the college and the expertise that's there. And the fellows of the college are just this wonderful group of people with expertise in many different areas.
For sure. It's still a matter of what's going on behind those gates, right?
Exactly.
Yeah.
It's like, people know the Mutter Museum, but it's so much more than the Mutter Museum.
Truly is. All right. The next question, I think, you've already, talked a little bit about, your calling as a physician, but, as a pediatrician, as a geneticist, you spent decades working with extremely vulnerable patients and their families, searching for answers about, often rare and difficult conditions. And how have those experiences shaped you as a person and as a leader?
First of all, just to be thankful, to be incredibly grateful for everything that's come my way. But, I've learned a lot of lessons along those, and it was 40 years. It's been 40 years. The first is, and I started my genetics training at the dawn of the molecular age, really. I mean, gene discovery happened a few years into my clinical practice. So basically, over the last 40 years, I went from, being able to use genetic testing to help increasingly larger groups of people, through the years. And so a lot of what I was able to provide for people had to do with the evolution of genetic testing, from chromosomes chromosomes were before me, but from, single genes to multiple gene panels to whole exome and genome sequencing. But you learn a few things. The first is that it's okay to say, I don't know. We don't know everything, but it's really important to be honest with people and to be there for them, to say, we might not know what your child has right now, but I'm going to be there. And the other doctors that I work with and all of my colleagues at the Children's Hospital, to take care of your child's needs until we find out. And we will never stop asking that question until we find out. And I think that people accept that, because they know that you're going to partner with them. I hate to, the term, it takes a community, it takes a village. Takes a village tends to be overused a lot, but that was actually my experience. Like the children I cared for had physical or developmental problems in multiple organ systems. And so my colleagues across the specialties were integral parts of that care. I helped manage their specialty care and worked really closely with pediatricians. I actually, went to school meetings to talk to, about IEPs. I spent 6 years on the school committee in Braintree, Massachusetts, the town I lived in, and was the chair for 2 years. And I think a big part of that was the fact that a lot of the kids I cared for really relied on specialized educational services. I was the one that was writing letters to the school department saying more services, more services, more services. And then actually, once I got on the school committee, I kind of saw the other side of that and was able to help to advocate for better services and better funding. But, you learn to say, I don't know, but you also learn never to stop asking the question and waiting for the answer, and the answer happens. And that's why I think I like innovation and thinking out of the box a lot, because I've seen it happen in genetics. We're finally at that threshold of going from sort of individual, rare disease to using genetics to help prevent disease. We think about preventing disease, but it's not sort of ingrained in our healthcare system. But genetic testing, I think, can actually help that. But there are a lot of ethical issues that go along with that, and a lot of other practice issues. So it's always exciting.
Okay. Well, you mentioned thinking out of the box and solving puzzles so far. So here's one. The pandemic has forced museums and libraries, kind of all over the world to close their doors and reflect on their missions and think about how they go about achieving those missions. And given this chance to pause and often pivot virtually, what opportunities do you see for the future of the college?
Oh, huge, huge. I think if we look at just what happened in healthcare, right? Doctors went from, I don't know, 10% telemedicine to 90% telemedicine overnight, seemingly overnight. Something that we've talked about for years, but it had to happen. And I talked to a medical school associate dean once who actually said to me, when, medical schools had to pivot too. You couldn't have students there. So all of a sudden, people went to virtual learning. And I had a medical school education associate dean said to me, Mira, we changed curricula, literally within a week, and it would have taken us 3 years to do it before, just going through regular channels. So I think the one thing that we learned is that you can do this.
Yeah.
Now, what's really important now is that people are recalibrating. Mm-hmm. It's important to say, okay, now we have to decide what you can do virtually, both for telehealth and for education, and what's better done in person.
Yep.
And that's, I think, the learning at this point. I think for the college, it allows us to increase our virtual options, to increase, virtual museum visits, information about the library, helping access that research piece of the library, the panels that the college, the educational activities they can do can be done virtually. Even if you want an in-person panel, I tend to like in-person activities because you do miss certain things virtually. It's that collegiality and the conversations you have kind of, over the water cooler or in the hall. But it actually allows people who can't get there to have the benefit of the activities. So I think it's incredibly helpful domestically, but it's also allows international opportunities.
For sure.
I'm already thinking about could we have educational exhibits, that are international. You can do things and engage with people virtually. So we're at that recalibration point, and I'm learning a lot every day about museums and special collections, but I'm sure that libraries and other museums are going through this at the same time. So it's a time to really expand the opportunities of the college, but also, more importantly, I think bring the college to more people.
Absolutely. Absolutely. Well, you've been learning about the college, through the search process and, in the couple months you had preparing for the position, and now in your first week here. So what of all the things that you've learned, what aspects of the college feel the most vital and important to you?
The heart of the organization is always the people. It's always the people that make up the organization. And I think in the first week, the staff has really welcomed me so warmly and so incredibly well. What I've seen and experienced is that the staff of the college is here for a reason. They love this organization. You all love this organization, and it sort of comes from their, your soul. And the souls are, museum, library, education, fellowship, the fellows program. And I just think that our history is really important. How history informs the future is really important. I kind of look at this as stewardship. I think that being a steward of this organization that has lived such a long and important life in many ways, and has survived through the years, is incredibly important to medicine. It's incredibly important to the public, and needs to survive into the future. Not just survive into the future, but to grow and thrive and morph into a even more relevant institution.
For sure, for sure. So finally, just please tell us a little bit more about yourself and why a move to Philadelphia appealed to you at this stage of your career and your life.
So it's really interesting. I grew up, I was a Chicago native. I spent 20 years in Chicago. I grew up in the Midwest and then moved to Boston for 30 years and then moved back to Chicago for, I guess, 7 or 8 years. And actually, I learned a lot about myself. The first was that I was the Midwest person in the East. In New England for a long time. There are differences in people. Midwesterners talk to everybody, not so much in New England. So when I was in New England, I was kind of the I was the Chicago person in Boston. And then I came back to Chicago and I realized that I was kind of the Boston person in Chicago. I think that in many ways, Boston imprinted itself on me. What I learned about myself was that East Coast sort of personality and imprinting and ways of communicating was really important to me. So I was looking for a reason to come back to the East Coast. After my parents passed, my dad at almost 97, 2 years ago, those personal reasons to stay in Chicago were no longer there. But also, I have a daughter here. I have my first grandchild here. And so that certainly was important in that decision. And I think also, finally, Chicago is a wonderful city, but it's really a big city. Mm-hmm. And that seems kind of silly to even say that. But I think that what I learned in my years in Boston was that I like the size of the city. And Philadelphia, I like the size of Philadelphia because it's a lot easier to access things. I'm a food person. I love to eat. The restaurants in Philly are amazing. I like to walk. It's a walkable city, but it's also a city of neighborhoods. And I think that's the Chicago piece of it. I mean, I'm a first generation person. I like a lot of diversity. I like having that in a city. And so going back to Chicago was eye-opening to me because to me it was going home. And then I found out that home was a lot different than I left it. Life isn't a straight line. The one thing I have learned is that life is not a straight line. There are a lot of pivots along the way. Things happen that you would never have expected. But, it's how you deal with those challenges that sort of define who you are. And you always learn about yourself. And so this is where one of the people on my team at the AMA, when I announced that I was leaving, sent me an email that said, Mira, it's kind of kismet when your professional and your personal lives come together in such a beautiful way. And that's what happened here.
Yeah.
If you believe in the universe sort of setting your path, this was one of those experiences.
All right. Well, that's wonderful. And thank you so much for being here and for spending the time to do this interview. Can't wait to see what happens next.
Sure.